Coronavirus-related hospitalizations in the Coastal Health District have surpassed 100. Memorial Health says the type of patients who need help is changing as the pandemic rages on. WSAV News 3's Kelly Antonacci has our continuing coverage.
Memorial Health says they have about 57 patients with COVID-19 right now. And despite an increase in cases in our area, they say they are nowhere near capacity. Associate Chief Medical Officer Dr. Stephen Thacker says that's because just 13 of 74 ICU beds are in use right now. And the number of people who need critical care is not going up.
But the number of patients that still need supportive care has. And thankfully, most of those folks have improved quickly and been able to triage out of the hospital to recover at home.
He says those patients are typically coming in for mild pneumonia or shortness of breath. And recently, patients are mostly between the ages of 20 and 40. On Wednesday, hospitalizations in the Coastal Health District topped 100. 2 weeks ago, there were just 45.
If we continue on with that approach, that it's not important to mask and socially distance when we can and avoid gathering in large numbers, that we're going to have these ebb and flows really throughout this process until we have a vaccine that's effective.
Dr. Thacker says even with ebbs and flows, doctors have figured out better ways to treat patients. They're using new antiviral medications, convalescent plasma, and just recently, steroids.
The combination of better knowledge about the disease and better treatment options helps us keep people from getting severely sick from this and needing to be ventilated in the ICU.
If that good news turns bad, the hospital can increase the number of ICU beds to 150.
Thinking about others in your family, in your community, really should be at the forefront of everyone's decisions about how they live in their community, how seriously they take this guidance about social distancing, and how seriously they take this guidance about using masks when we're in public.
Memorial Health says their surge plan may involve making room for additional patients or contracting additional staff. Right now, though, they say that is not necessary. Reporting in Savannah, Kelly Antonacci, WSAV News 3 on your side.